Okay, people are asking questions about
The
Plan
abort
B,
Plan B.
and we should talk about this. So this is like big news. Okay, so and I don't think we've talked about this
No, we haven't.
since we've had a show. So
Mm.
big news happened last week with the Biden administration and the crazy partisan FDA, which does, whatever the Biden administration wants them to do. So let me just kind of explain what has happened. Um, several years ago, um, several years ago, the the abortion industry created uh, this way for medication abortion, which is the RU46 pill, to be distributed through telemedicine. Okay. And basically, what that meant was that a doctor did not have to be in front of a patient giving them the RU46 pill, which is Mifeprex, did not have to be face to face with them in order for them to receive the Mifeprex pill. So basically, uh, a lot of states swooped in and said, no, absolutely not. We don't want this to be accessible to patients without them being face to face with the doctor. So the abortion industry found some loopholes, things like that. States tightened up their regulations. And that was kind of that. In some states, they were still allowing telemed. In some states, they weren't. Like where I live in Texas, telemed abortion was not allowed. And that was kind of the way it was for several years. Now there were some regulations that were loosened on the the gestational age that you could have a medication abortion. So when medication abortion first came out decades ago, you couldn't have a medication abortion past 7 weeks. Then it was 9 weeks. Then it was 10 weeks. Now it's 12 weeks. So now let me make this clear. RU46, what we call medication abortion or chemical abortion, is different than emergency contraception. So, emergency contraception goes under different brands: Plan B, Ella, One Step, Julie. There's different brands of emergency contraception, and we can talk about what that does, but that is different than medication abortion, chemical abortion, which is RU46. Okay. So now, last week, okay, wait, let me stop. So when Roe was overturned, now there are about a dozen states where abortion is completely illegal. So that means surgical and medical chemical abortion is also illegal in those states. Okay. So there were groups that came together and abortion groups that came together and they tried to figure out, okay, how do we make medication abortion available to women who want to have an abortion, right? Obviously, these brick and mortar abortion facilities cannot stay open, right, and perform surgical abortions, but how can we get medication abortion to women? So what they did was they set up websites, and right now there are over 70 websites available to women in the United States where in states where abortion is illegal, where a woman can go online. You could do it right now. You could go online. You can type in your information. You can type in your date of birth. You can type in your last menstrual period. And literally, you can type in any date for your date of birth. They do not check an ID. They don't ever ask for an ID. So you could be 13 years old, but type in a date of birth that makes you 18, and they'll give you the pill.
Unbelievable.
You can type in any last menstrual cycle date, and as long as it falls under 12 weeks or 10 weeks, depending on the site, you could be 16 weeks. But as long as you type in the right date, they'll give you the pill because they don't require that you have an ultrasound. You don't have to be under any sort of physician's care. Okay. So as long as you are clicking the right buttons, as long as you are typing in the right date, they will push you along in the process. You pay about $110 through their payment portal, and they will mail you the pills. Now, the pharmacy is in another country. So this is how they're getting away with this. So the pharmacy is generally in India, Belgium, or China. Okay. That pharmacy will send this American woman pills from their out of country pharmacy. The pills take up to 4 weeks to get to this woman in America. So even if she was 12 weeks at the time that she put in this information, now she could be 16 weeks by the time she takes the pills.
Oh my gosh.
Now, let me tell you what happens to a woman who takes medication abortion at 16 weeks. It is extremely, extremely unlikely that her body will pass a baby from her womb through medication abortion at 16 weeks at the dose that they give her. So what is most likely to occur is that the baby will die, but it will stay in her womb because the medication is not a high enough dose to allow her body to contract enough, allow her uterus to contract enough to push the baby out of her womb. So what will happen is this dead baby will stay in her womb for weeks, but she won't know. She won't know that the abortion isn't complete because what's happening is online, and you can look this up online, the abortion industry is telling these women that having a medication abortion is just like taking Tylenol. They are telling them that they will have mild to moderate bleeding. So they take these pills and they probably will have some bleeding. And so they're like, oh, that was the abortion. That's it. They don't realize that inside of their womb is a large, fully developed baby. And so they have a little bleeding and they think, oh, that was it. They're right. It was just like taking a Tylenol. It was like nothing. They don't realize that they're carrying around a dead baby in their womb. And what will happen is that after a couple of weeks, they will become septic and they can die. Or what will happen is that part of their baby will come out of them after taking these pills, but the pills aren't strong enough to remove all of the baby. So maybe they'll have, an arm or a leg come out, but not the entire baby. But the body will then treat that baby like a foreign object, and it will try really, really hard to remove this foreign object from the body. And what will happen is this woman at her home will begin to hemorrhage, and she'll hemorrhage to death at her home. She'll faint, she'll pass out from the amount of bleeding, and she'll die on her bathroom floor or somewhere in her home. The FDA and the Biden administration have now greenlit this process into pharmacies. So now women don't have to wait to get these pills from Belgium or India or China. Now they can go into any local pharmacy with a prescription that they get online from one of these websites. So they can get a same day prescription for 20, 30 bucks. And they can walk into their local pharmacy and they can present this prescription. And in the same day, they can get these medication abortion pills without being under a doctor's care, without ever having seen any medical personnel, without having had an ultrasound. These women don't know if they even have a pregnancy in their uterus. They could have an ectopic pregnancy. Taking these pills could actually rupture their fallopian tube and cause them to die. They don't know how far along they are in their pregnancy. They have no idea what's going on with their body. This could be a 13-year-old girl that's a victim of sex trafficking. This could be a 15-year-old girl that's trying to hide the fact that her soccer coach has been raping her for the past 2 years. We have no idea. The Biden administration, the FDA, have now made it so that these women's homes are now abortion facilities. And the terrible thing about it is that these women who have successful medication abortions, they are going to pass their babies into a toilet at home. And they're going to see their fully formed babies sitting in a toilet. And they're going to have to make the decision. What do I do with this baby? Do I flush this baby down the toilet? Do I scoop this baby out of the toilet? What do I do with it? And then these women are going to have to over and over and over again go back to that bathroom every day, day in and day out, and relive that trauma over and over again. And we have no idea what psychological impact that is going to have to these women. I believe we are going to have increased suicides, increased suicide attempts, increased depression, increased anxiety. I believe that women are going to greatly suffer. We already have stories from pregnancy centers of these women going through these medication abortion procedures, scooping their babies out of the toilet, putting them in Ziploc bags, and going back to pregnancy centers and saying, what do I do with my baby? This procedure is horrific. And the Biden administration, the FDA, have gravely failed women. And I believe we are about to see some pretty serious repercussions because of it.